Good morning.
Good morning.
I teach medical students, nursing students, pharmacy students, and so forth about this period of time and about the ethical dimensions of this period of time. Can you hear me? Is this better? Not yet. Okay. So it's important for me to include images when I talk to them. And thus I approach this period of time not as a historian, which I am not, but from the perspective of a person who is a healthcare provider. I'm grateful to my funding sources, and I particularly want to acknowledge the Holocaust Museum in Washington for the use of some of the images in this presentation. Keep in mind, if you would, this abbreviated continuum from the forced sterilizations to the so-called euthanasia program to the final solution. Be aware that each of these actions required the willing participation of physicians and nurses. This is the question that I was asked to discuss today. As you might imagine, there is no one answer to this question, and I'm not convinced that it is in fact knowable. However, in thinking about this, and again as I present this information to medical students and nurses, I believe that there were 4 factors that were essential for this to occur. I think one of the reasons that not all the factors are indeed knowable is that there were people that did refuse to become involved. But because they were not part of post-war trials, then we largely don't know how they were able to do this, or even more importantly, why they were able to do this. So the first factor that I identified is that some groups of individuals became not only devalued, but ultimately despised. And they were viewed as threats to society and the welfare of the German people. Among these people were the disabled, the Jews, the people who were thought to have hereditary conditions, and note that I said thought to have hereditary conditions, people of African descent, the Gypsies and the Poles, and becoming devalued and ultimately despised was the first step along the continuum leading to a government-sanctioned program of elimination. So how did some groups of people become devalued? I'm sure you're all aware of the pseudoscience of eugenics, and certainly having occurred a full 70 years before National Socialism, then that was an important factor, not only in Germany, but it was very big throughout Europe and in the United States as well. People who were unable to work, even people in psychiatric hospitals, were regarded as useless eaters. Even in psychiatric hospitals at that time, patients were expected to contribute to the welfare of the institution. The institutions had their own dairies, their own farms. Some of them even grew Angora rabbits. So they were, because they received such a small amount of government funding, then they had to be somewhat self-sufficient. Thus, people who were unable to work in any way became the most vulnerable. Professor Bartov talked about anti-Semitism and the propaganda, and the propaganda against the Jews certainly had gone on for many, many years, and it was very widespread. But I wanted my students to see how much a part of everyday life it was. So here, for example, I hope you can see that. is a parade, but the box on the side of the wall says, without a solution to the Jewish question, there is no salvation to the German people. And again, another street sign, and this one says, defend yourself and only buy products from German merchants. This appeared in a Jewish-owned shop. Again, another propaganda showing that the burden of hard labor was borne by non-Jews. So the emphasis here is that the Jews control the economy, but did not work quite as hard for it as some of the laborers. And again, my reason for talking about propaganda and the role of physicians and nurses is before physicians and nurses entered school, entered professional education, they were exposed to this just as the general public. So they entered with this mindset. The Jews were regarded as a threat to so-called racial purity. And the Nuremberg laws were enacted in order to prevent the intermarriage of Jews and non-Jews. Propaganda slides revealed that there was a perception or the government wanted there to be a perception that Jews were a source of disease. As National Socialism took over, then soon physicians and nurses who were Jewish could only practice on other Jews. They were not allowed to work in environments where they had non-Jewish patients. Propaganda efforts were also directed at children. There were booklets, textbook examples, and posters. The Poison Mushroom was a very popular anti-Semitic children's book at the time. And now we move to the devaluation of the disabled. Again, they were viewed as useless eaters and a threat to future generations. They were reviled as an economic burden and somewhat less than fully human. And in order to convince physicians and nurses of the low value of their life, then they were portrayed as leading a life of great suffering. Involuntary sterilizations took place. However, let me say this, the first involuntary sterilization laws were passed in the United States in the state of Indiana. Germany's laws were not passed until much later. In 1920, there was a book that was published that had a profound impact upon the idea of so-called euthanasia. It was written by a law professor and a psychiatrist, and it argued in favor of eliminating the disabled. Interestingly, Binding, who was the law professor, was married to a Jewish woman, and he was eventually forced into leaving his academic position. He became opposed to the so-called euthanasia program when one of his relatives was killed. This opposition was despite the fact that the euthanasia program was largely grounded in his writings. From a high school biology book, a picture showing the cost of caring for the disabled, and a propaganda slide that emphasized the so-called goodness of sterilization and of killing the disabled. It was, quote, the right thing to do. Here are physicians in an unidentified psychiatric hospital showing them with patients with life as only a burden, whether it was a burden to the doctors, whether it was a burden to the patients themselves, or to the institution and the government. In one of the euthanasia hospitals and in one of the post-war trials, Dr. Hilda Wernicke described the condition of the patients at her institution. And it was her thought that because they were in such horrible condition, lacking even human dignity, that this enabled the nurses to not have emotional feelings for them, but in fact view them as subhuman and be more willing to kill them. I mentioned a high school textbook example, and again, this was a math problem based on how much it cost the government to keep a disabled person alive and institutionalized. And the next poster, or the next thing from a journal, emphasized to the taxpayer that this is your money that is doing this. This is a picture of a psychiatric hospital in Vienna. And I put this in here because I wanted you to see the rather rudimentary conditions of psychiatry at the time. If you look in the corner, you'll see a woman who is in a bed that's rather like a cage. At the same institution, a child was killed. Her mother was a nurse, but she was a single woman and had to work full-time. Therefore, her mentally disabled child had to be institutionalized, and she tried for 2 years to keep him from being killed. He was, in fact, eventually killed, as was this child. So we have physicians and nurses getting into their professional education programs already inundated with the propaganda of the general public. Once they got into their programs, though, then an emphasis on loyalty to Hitler was expected. It was part of the oath, in fact, that the nurses took when they graduated from their nursing program. Nurses and doctors had courses in racial hygiene, and in fact, the most prestigious universities at the time had professorships in racial hygiene and journals that were dedicated solely to the topic. The personnel at the euthanasia centers were expected largely to live on the grounds of the institution themselves, and the purpose of this was to keep them from interacting with the people in the town. This allowed them to form friendships with each other, but kept them from discussing the events of the institution. So the next influencing factor, the second one I identified, is during this period of time, the health of the individual, particularly an old person or a person with a disease, became very secondary to the health of the people in the aggregate. The human being was only a temporary carrier of the perpetual protoplasm. Thus, the care of future generations far exceeded the care of the here and now people. Primary concerns of physicians should be for those who can contribute to the health of the people, and the weakly and the useless were not to be maintained. So the principle of the care of the strong and the future generations provided a medical practice that favored the sterilization and the killing of the disabled. Nurses were actually taught that it was harmful for them to take care of people that were disabled. So the first two factors were the hatred and the devaluation of the Jews and the disabled. And the second was the value of the health in the aggregate. So the third factor that I see as necessary in convincing nurses and physicians to kill people was the government had to sanction the killings. This was the authorization that I'm sure you've seen many times, September 1, 1939. The points of this is it was an authorization. It was not a law. And it in fact said one was allowed to do it. It did not say one had to do it. This is a picture I actually took at Bernburg, which was one of the killing centers, and they have a very small memorial site there and a small archive and so forth. But I wanted to show you where the people were actually gassed. The patients were transported to these centers and they were gassed. You'll notice in the back of the room, that circular thing is a mirror. And that was so people could look through the door as the chamber was sealed, and they could make sure all the people in the corners of the room were in fact dead. So the fourth factor is that the killings had to be perceived by the doctors and nurses to be good or beneficial. By killing the Jews, they removed an economic threat. They removed people from good positions, university positions, medical practice, and so forth. They removed one of the threats to racial purity as they saw it. And in time of poor economy, they made housing and wealth available as the properties were looted. Louise was a nurse that worked in one of the euthanasia hospitals. She worked in the institution in Mezerets, which now is in Poland, and which I visited 2 years ago. Louise and 13 other nurses were not tried until 1964. So when you read her statement, keep in mind that she had a good 20 years to think about what she did. She was accused of killing 210 patients. She never denied that she did it, but this is what she provided as an explanation. She herself would want to be killed if she were terminally or severely ill. She did acknowledge, though, that she had battles of conscience while she did the killings. Interestingly, the 14 nurses, though none of them denied what they did, were all acquitted in 1964, which is different from the first nurse and the first physician from the same institution. They were tried in 1947, and they were both hanged for their actions. So killing the disabled protected the genetic heritage, made wartime resources more valuable for more deserving people, and according to some, in fact, relieved people of their suffering. So the questions that remain with us are truly, I think, unanswerable. And that is it possible to fully understand this? Probably not. Can it happen again? Certainly, there are things in place to keep such a thing from happening again, but there are some alarming recent events that I'm sure you're aware of. The first one is by the U.S. Army at Abu Ghraib prison in Iraq, where evidence of the torture of prisoners was overlooked by medical personnel. The prisoners were sent to the hospital, and it was clear that they had been tortured, but for a very long time this was not reported. Rwanda, as you know, then many people, 500,000 people were killed there, and little external intervention was done with that. Sadly, nurses and physicians were among the killers. And most recently, in the city of New Orleans, Hurricane Katrina hit. And one of the places that was in very desperate condition was, in fact, a gerontological unit in a hospital. And help was very slow in arriving, and eventually, when it did arrive, a number of the elderly patients were dead. So one physician and 2 nurses were accused of killing these patients with an overdose of medication. Interestingly, an indictment was not brought forth. The case was dismissed despite there was overwhelming evidence that the people were in fact overdosed. So when we talk in this morning's session about racism, discrimination, and so forth, then I think we can all have a heightened awareness. Thank you.